Greetings to all those present. We are here today to discuss a very complicated, important topic, and that's the topic about which we have many questions, because when it comes to the cases of rape, it's not just about algorithm, it's about how the doctor listens, how the doctor asks questions, and how he says you are not guilty, so that people who come for medical assistance go to the doctor and ask for medical assistance. First of all, I would like to say that we are talking about the cases of clinical support of the patients who were raped. It is very important how the doctor would treat the victim and how the doctor would provide medical assistance. Today, we have the guests, the speakers, who are working on this very important topic, and they will talk about all important things, and you will be able to ask questions to our guests. Also, I'd like to say, don't be ashamed. Ask questions while the person is speaking. I suggest, in order to make it in a disciplined way, if anyone wants to ask question, please raise your hand and ask question. Okay, and today we have here, oh, I'm sorry, that's the first time when I'm at such an event, and that's the first time that I'm the moderator. So we have Natalia Rzhenko. Natalia is a doctor, infectionist. She is a consultant in the Department of Counteracting HIV Infection. Also, we have Nazar Tokar here. He is the head of the team AHF Ukraine, and also we have a person present here who basically will talk deeper about these cases of rape. Volodymyr Panov. Sorry, cannot hear. He will tell us about cases of clinical and treatment of rape. Volodymyr Panov is the obstetrician and the doctor on who's also working in Dniprovsky Medical University. And before we start talking about clinical treatment of cases of rape, I would like to ask all of you, how do you understand what is this clinical follow-up or clinical treatment? What do you understand by clinical follow-up of the cases of rape? Okay, great. What else? Okay. Then I would request Vladimir. I thought it's not my topic, but I will talk about that. You were right saying that that's just, these are comprehensive measures, not just medical measures. That's algorithm of 8 steps. How many of these 8 steps belong to medical part? What do you think? One. It's called medical part. That's only one part. There are many things which are in it, but I could feel we have 8 steps. I don't remember all of them. I will briefly tell you that the first step is the first medical assistance. It could be provided not just by medical workers. When people come with this problem, we ask questions according to a certain algorithm. We ask what happened, we ask about the needs, and we are trying to provide first medical and psychological assistance. Then we need to find out the circumstances of the incident and sign informed agreement. What is informed agreement? Yes. Maybe getting information about what services the person could get during the consultation, and the fact that the data will not be transferred anywhere. It has 4 parts. Super. You understand it very well. Yes, there are 4 things there. It's about undisclosure of data, informing the police. For that, there are special separate agreements. You can agree that all the everything is collected, all the information is collected. Then you give the agreement, or you do not give the agreement for collecting all the information. Also, you can change your attitude to that. You can change the agreement. Maybe first the person agrees that the material will be collected for the police, and then later this person may disagree with that, and then this activity will be suspended. Then there is part which is about medical examination and then treatment. The 6th step is to take care of the security and refer to the place where the person can get assistance. Where can a person get assistance? That's the question to you. Do you know some clinical cases? Maybe you know about people who are around you. Maybe you have your own case. Please tell us. In general, there are several components. There is a state support and the social support, then NGOs and medical institutions. Do you know where to look for that? AOR. UNFP. I know that they're developing that, where the person can go to the dashboard if the person knows about that, and there will be state institutions, their contacts, and NGOs with the contacts, and that's where a person could go for help. So please go to the site of AFNP. They have such thing as referral cards of reference. They update them every 3 months, I hope. And in each region, you can see all the contact details where you can go. You can get registered there. You can get medical assistance, free legal aid. Maybe you heard about the organization Дівчата Girls or Yurfem. They provide free legal aid. If you need to get some shelter, to get some safe room, they will help in that. There are mobile teams which go to the place where the rape was executed, and they evacuate person from there. In Zaporizhia, for example, there is a green room which is for children, where you can take a children there and you can work with the child there in a safe space. And then is the medical part is there's not much of a medical part in all these steps, and we have the whole set of measures. Do you have any questions to Volodymyr? Maybe the audience has some questions. Thank you for the presentation of algorithm. Is this algorithm for women or women and men and trans persons? That is for everyone. That is some regulation of the World Health Organization. Any other questions? Thank you. Also, I'd like to ask a question to audience. Maybe you have maybe you can tell about some cases which you had and it was related to access to medical assistance, or maybe you faced some barriers when you were trying to get some medical assistance. Please share your experiences. Then I will say, as to our figures, you asked about women, men who can come. How many people came in relation with the rape? Do you know, is any type of rape regulated by the legislation? Which type of rape is regulated? Correct? No. There's no such definition as gender-based rape or violence. There is only one document. It regulates domestic violence. Also, there's a criminal code where they criminalize the domestic violence. Now, there is a draft law on introducing amendments to the criminal code, and this will strengthen the responsibility for domestic violence. And as far as I remember, they will introduce criminal responsibility for stalking. Also, I'm from Alliance Global. It's about the access to services. There are cases of rape when the client in a little settlement didn't want to go for services. The client was just afraid and he didn't have access to this service, even though the service exists. Yes, there are frequent cases when the victims do not go for medical assistance because, first of all, there's stigmatization, the fear of stigmatization, and they are afraid that they will be rendered medical assistance, but they go for medical assistance more. Well, they think that medical worker will tell the law enforcement bodies, and very often it happens in cases of domestic violence. So the victims avoid going for medical assistance. In 2024, in first half a year, there were 97,000 registered cases of violation. 8,000, almost 9,000 reached the office of the general prosecutor, and 6,094, these were the cases on which they started working. Most of them, they were related to women. Okay, I would like to go to the next topic, which is also very important when we talk about clinical cases of rape, and that is pre-contact and post-contact therapy. Many people, they either do not know what it is, or they do not know where to find this information. Me personally, when I talk to my colleagues, I have just recently learned what's the difference between post-contact and pre-contact therapy, because before that, in my legal work, I didn't come across that. And I request you, Nazar, to tell us about that. First thing I wanted to share was, I liked what Maxim said. That's a huge problem. The problem when we are saying that there is a problem, not in the cities, but it's in regions where there are there is more stigmatization. First of all, people who face it, everything should be based on the principle of safety, non-discrimination. And when we are talking about some small village, a small region, and we understand that there are many internally displaced people who had to move to different locations, and when it comes to men, that's a big problem, because they cannot go for post-contact assistance. They cannot discuss the problems which really concern them. The doctor, if the doctor doesn't know what is post-contact prevention, or if the doctor knows what post-contact prevention is, it's great. I'm to say nothing about pre-contact prevention. These are things on which we have to work. That is a stigma, discrimination that we need to work on with the medical workers. There is a myth that men do not suffer from rape. And in small regions, people believe it, especially in the regions where I'm from, where it's very conservative, religious. And that's a big problem. That is why we need to teach doctors so that they can provide security, confidentiality, and unbiased attitude. That's the golden rule that you have to understand. There are stories when a person comes out of the family doctor, and then half of this clinic knows about that. The doctors tell their families, families tell some people they know, and everyone knows. And that's a big problem. In the regions, there are many representatives of LGBT community who do not feel free, and especially when it comes to sexual violence, when it comes to war. Thank you. I support this topic because that's what people are talking about during all the trainings and workshops organized by the Ministry of Health and together with the World Health Organization and UNPA. They always say that you need to teach medical workers how to work with different categories of patients, because unfortunately, very often we see cases when medical workers do not know how to communicate with patients, and then the patients complain. Then we discussed pre-contact, post-contact prevention. So we heard these terms, but now for those who do not know, we need to understand what is the difference between these terms. And Natalia will tell us about that. Natalia, the floor is yours. I'd like to support Nazar. Really, medical workers, not all of medical workers know about these things. That's the problem, especially in small regional centers where there are not so many HIV patients, and the medical workers do not have experience in that. When we talk to them, we learn this information that people, medical workers cannot ask questions, certain questions. They feel that it's like they interfere with the personal space. And it's not decent to ask such a question. You sort of humiliate the patient who has come to you when you recommend the examination related to HIV or some things, if you recommend certain things which are related to pre-contact or post-contact prevention. Talking about trainings, yes, in the medical sphere, there's a huge chunk of personnel, and the medical persons are to be trained, especially when it comes to pre-contact or post-contact prevention. My question is to you, to those who are present here. Have you worked with, did you take pre-contact prevention? How did you learn that there is a pre-contact prevention? We understand that there is different type of information. Was it difficult to get such information about pre-contact prevention? And was it difficult to get the pre-contact prevention itself? I can share my experience because I work in the organization which provides pre-contact prevention, and I know what is pre-contact, post-contact, and we have the database of family doctors, and there was no problem with getting. You go there, it's confidential, you are told again what it is, how to receive it, how to take it, then you they make a test. Based on the test, they follow you up, and the doctor will write because you are in the database, and the doctor will remind that in a week you can come and get another portion of this medicines. I learned about that from social worker. I'm the 6th-year student of medical university, and we also learn what HIV infection is, but they do not explain to us what pre-contact prevention is. You learn it not from medical workers, but from social workers who know more about that. And I believe that when you teach doctors at the universities, then you need to give more knowledge about prevention, because disease prevention is the main thing in the medicine. But unfortunately, there's a problem still with that. Yes, I agree with you, colleague. Yes, there is a big problem because people do not know, and even if you take people from LGBT community, some people who are very active, you write to people, but most of them haven't heard this abbreviation PrEP. And we are not talking about the people from community who are less active. There's a big problem for people to learn about it. That's the problem. I also wanted to ask you whether you know what's the difference between pre-contact and post-contact prevention. Pre-contact prevention, it's called pre-contact because you take it before you have the sexual act to ensure that you don't get the infection post-contact. It's a different thing. If you know that you had a partner who possibly had such a disease, then you have 72 hours to ensure that you don't get this disease. Yes, you interpreted correctly. Pre-contact prevention, it's the prevention of HIV disease before the risky behavior and post-contact. It's after the risky situation, and it's up to 72 hours. I would like to remind you briefly about pre-contact and post-contact prevention. That's for everyone. Post-contact prevention, when there was the risky situation, the indication for that is the situation itself, and the doctor will decide whether it's indicated based on the situation. The indications for post-contact prevention is a contact with biological solution which has high concentration of virus. It's blood, sperma, also the contact with the liquids that do not have high concentration of virus, but when there are some additions of blood, when the skin is injured, then it's considered to be a high risk, and it's an indication to prescribe the post-contact prevention. And this prevention is given free of charge. In order to prescribe it, certain conditions are the negative status of a person who had this post-contact, who had this contact. If you identify HIV infection, then you do not prescribe post-contact prevention, but antivirus therapy. There should be no symptoms of acute infection of HIV, and also the indications and the time frame is up to 72 hours. That's very important. If the post-contact prevention is not it's not prescribed, if it's more than 72 hours and there are signs of HIV infection, if there's a reaction to some components of this medication, but we prescribe it to everyone. As to the preparations, which preparations we prescribe for post-contact prevention, these are preparations which are the scheme of treatment of HIV infection. One pill has 3 preparations, and it's prescribed for 28 days. Before that, we examine person whether the person has HIV infection. We take blood and we look at the function of the kidneys and the liver, and we recommend daily examination of a person that receives post-contact prevention. In a month 3, 5, and 6, the control analysis of blood. So we are just observing the person that had the contact so that we do not miss the infection itself, and so that we take measures on a timely manner. If the post-contact prevention, the person that receives it, and the person missed taking some preparations and the time is less than 72 hours, then we replace this preparation for alternative preparation, and then we again observe this person so that the person completes the full course. If there were more than 72 hours that passed when the person missed taking this medicine, then it's not active, and we recommend that the person should go for HIV examination. So, and basically, if a person comes to us and that was more than 72 hours after the situation, risky situation, then as doctors, what could we recommend? And you could recommend it to your people you know. The person should go to the doctor, should get examination for HIV infection, and then control after 3 months the examination again and recommendations as to this period and use of condoms. That's what refers to post-contact prevention. The term is 28 days, and the scheme of antiretrovirus therapy, it's certain medications as to pre-contact prevention. Pre-contact prevention has been introduced in 2017. In 2017, 4 persons received it, and then starting from 2019, this prevention is expanded. And I remember how in cooperation with NGOs, we started prescribing for the first time this pre-contact prevention in the regional centers of HIV prevention. I remember my first patient, it was something new. Now this pre-contact prevention is included into the standards. So pre-contact prevention is possible in Ukraine. And these are both different forms. The pill form and the pills are taken by people who have risk of getting HIV, those who are 15 years plus of age, who are not HIV infected, and they don't have symptoms of acute HIV infection, and they have high risk of HIV infection. The pills, these are, there are some Ukrainian medications in Ukraine which are prescribed by the doctors who are infectionists, and now family doctors started prescribing it to people who need it. What do you know? What schemes do you know? Tell me. And there are 2 schemes, and I wanted to add, many people believe that the pill for gays, it's for everyone, for men, for women, for trans people. But there's a difference in when this preparation starts acting. For men, it's in 7 days, for girls and trans guys in 28 days. There are 2 schemes. First 2 + 1 + 1, 24 hours before the sexual act, and there is a daily one, and that's more stable, more universal. You can be done 99% sure that you will not get this infection if you take it every day at the same time. Yes, you know it so well. And there are 2 schemes, daily taking, and as needed, it's known as 211 daily. Take is good for everyone, irrespective of the gender, of the age. There is a formula. The person takes it for 7 days, then the X days, which are days of risky behavior, and then 7 days more after risky behavior. So first 7 days you take it, and the preparation is accumulated in the body. It reaches sufficient concentration, and for that period it's recommended to take to also use individual protection means. Then you take this preparation on a daily basis. You select time, you discuss all the details with the doctor, and the daily take of the preparation for the period of risk. Then if there's no more risky behavior, then from the last risky contact, 7 days more. As to pre-contact prevention as requested, this is recommended for transgender people, people with different gender identification, whose gender was defined as male gender when they were born, but they have a high risk of getting infection through sexual contact. And these are people who can plan their sex and who can delay it. And they take 2 pills 24 hours before the sexual contact, and then 24 hours. In 24 hours, they take the 3rd pill, and then in 24 hours, 4th pill. If the contact continues, then the person could switch to a daily scheme of taking. If there's no more risk, then the scheme is completed by taking 2 more pills after the risky contact. As to the analysis, which are mandatory, that is the mandatory examination for HIV infection. And I would like to remind, sorry, Natalia, that's very interesting information, but we have certain timing. And I would like us to listen to one more remark. Please tell me. It's interesting how easy it is to get post-contact prevention in the regions. Are there any difficulties with that? You don't feel it? Thank you, Natalia. And now I would like to ask Nazar to tell us about the access to these services for victims, and what's the problem of getting this access. Thank you. In fact, there's a problem that the person doesn't feel safe. They don't feel safe in places where they should feel safe, because first of all, it's important, well, we can see that there's sexual violence only in a situation where the person usually feels safe. When we go to the medical institution, well, for example, I don't have this feeling of personal safety in my clinic. There is a problem. It would be great if we would introduce into the roadmap the fact that we need to create a mechanism, a quick mechanism. So it's not like the person comes to me, we have psychological support, And we are testing and consulting on HIV infection so that I don't need to find friendly urologist in one clinic, friendly proctologist in another clinic, and so on, and the lawyer from a different city, for example, and the person who comes in condition of stress, the person after violence that he or she survived, they have to again and again tell their story to every specialist, and we worsen the psychological condition of this person. The primary psychological assistance shouldn't be biased. It doesn't matter who comes to you, man, woman, transgender person, doesn't matter. The main thing is the person should feel comfortable. And that's the problem. And for that, we need to create the mechanism which will not have billion of steps, because post-traumatic distress is something which may happen later. And it is important to register all these crimes, especially when it comes to sexual violence, which is related to war conflict. That is what we need to teach people about, and that is very important today. That is very, very painful, sensitive for the community. Very often we don't know where to go. Very often we are not heard, and we live with this pain inside us. And the person doesn't know what to do and doesn't want to go even for primary medical assistance. That is why our organization created a call center in Kiev. We have the testing point in Lviv and other cities, and that's places where person goes and the person could feel himself or herself safe and could feel that the person is supported. You need to understand that who heard about DoxyPEP? One person. DoxyPEP is a therapy with some medication, which is... Yes, please. Okay. And our organization has been implementing it according to recommendations. We recommend it, and the health sector institution should support us in that. Thank you, Nazar. That's true that we need to support such approaches. It's envisaged by the standard of medical assistance, and that is when it comes to contact, pre-contact prevention, and it says to who we subscribe what. Thank you. Anyone could prescribe, but it could be pre-contact and post-contact prevention. It's 72 hours before and 72 hours after. It reduces the risks of certain diseases, of getting certain diseases. What I would like to say, Nazar, come to me to Dnipro. My office is safe. I also would like to mention stigmatization. I have the impression that we discuss such thing, that after rape you have to prevent HIV, but there's a whole set of medical events you could see looking at a person that there was a violence, and that's the right of a person to go for medical assistance. First of all, you have to treat physical traumas and wounds. If there was a violence in the street, there's the soil there, and there are many bacteria there. As minimum, it's the complications, but the biggest problem is lethal. It could be lethal if you do not get vaccinated. You can go to your doctor, and the vaccine for vaccination will be free. Also for girls, it's the undesirable pregnancy. Not all methods could be used during these hours. There are 5 types of contraception. In Ukraine, there are 2. You have 72 hours to take a pill, the special preparation if there is a need. The next thing is vaccination against the virus, hepatitis B. Okay, great. We know about this, and also the prevention of infections, sexually transmitted infections. There are 5 infections which are included into STD infections. The next one is on medical part, and that it's not part of standard program, but who heard about papilloma virus of a human being who's vaccinated? That's super. I have 2 doses, and those who are older than 15, we need 3 vaccines, because that virus causes 6 types of cancers. You need to have 3 doses of vaccination. Yes, that's expensive. It's 15,000 hryvnias, but to treat some oncological diseases, much more expensive. Find someone who can help you, because according to international standards, you need to make this preventive vaccination. Also, 1 dose of the best vaccine for the girls of 12-13 years, and that's part of the national calendar of vaccination. If you have people who have such children, recommend to them to go to the doctor. Talking about barriers, yes, there's no trust to doctors. I'm the doctor. The doctors do not know much. Many do not know much. I would like to mention this vaccines against papillomas. I understand that 6 persons, well, who of your clients came for Toxipep, who knows about Toxipep? In Lviv, there was a case when we heard about it, but it doesn't work like that. You need to talk about that and discuss it, and the antibiotics were prescribed. You have to take them, take it. Okay.
Ні, він видає дерматовенеролог.
No. The mic is not used. Yes, they will send you to pharmacy, but the problem is to find a doctor who would know it. We know, basically, no family doctor As of today, no family doctor knew about this method. I know that because I'm preparing to the teleconferences. I'm the doctor who teaches others, and that's why I teach my interns at a high quality. But the system of training should be much better. If you met 2 or 3 teachers who love their profession and tell about these things, then just they should be very, very dear to you. It's difficult to find the person who will tell that it exists. It costs 50 hryvnias for 10 capsules, and you have to take 2. But family doctors, they, for example, know that you have to prescribe some prevention if in other cases. All doctors know how to treat, how to diagnose, but how to give advice. It's great that we have NGO sector and medical workers, and that is something. Talking about violence, it's something of importance. We need to disseminate this information, and so that the violence that happened doesn't become more traumatic. Thank you, our speakers. We discussed many things. It's very important. Also, I would like the question. And the question to all the speakers. We are saying that not doctors are experienced and not all doctors give you advice. I'm sure that in this sense we are talking about adult patients, the doctors and so on, and we mean that the patient is an adult person. But what do we do with teenagers? Because not all adult patients understand it, understand the topic of violence, what are the signs of violence, how to counteract violence, how to ensure that it doesn't happen to you. But what about teenagers? There are 2 ways to reach them, via family or school, or via the teenage community. What to do here with violence, vaccination, doxy, BEP and PrEP, and other things? That's a difficult question. Thank you for that. We can discuss it for the whole day. First of all, the situation will improve because in Ukraine there is a strategy of development till 2030, and according to that, 30,000 medical workers will be providing services on gender-based violence. We have the international law and Ukrainian law, who is considered, according to the Ukrainian law, the person who can select the doctor who can go to get medical assistance without parents, how old the person should be. I heard 14. Who's for 14? Who's for 16? Who's for 18? 14. If a person doesn't have some diseases of intellectual development, that is the person who can select the doctor himself or herself, and they can make vaccination, and they can even interrupt pregnancy themselves. if we take the international law, and if we take our law of Ukraine, or the order from the 1st February 2019, which regulates family violence, the difference between children, adolescents, and adults is one. If,
Вже заговорююсь. В кінці дня,
sorry,
тобто організації, які займаються в нас дітьми.
the,
Органи опіки і все інше, вони нам
if
повідомлені.
basically the organizations that work with children should be informed. There's no other difference. Vaccination is the same thing. We provide medical assistance same way as to adults. To who will a person go? To gynecologist if that was a rape, or to some other doctor? I don't want you to understand that you will have to go only to gynecologist if it's about the women, to any medical worker. The system is such that you should have a family doctor. The first person you go for medical assistance is your family doctor. But I'm so sorry that sometimes family doctors are not competent and we teach them. Very often I see when vaccination is recommended and the family doctor says that you have virus and you cannot be vaccinated, it will not help you, or you are pregnant. That's the problem. The problem is in training. I will say that in fact I believe that we need to do that via schools because all are to be taught. For example, I learned everything, so to say, in the field. That's what everyone does. The school doesn't teach us as well. You will not be able to do it via school. I believe that you can, because, well, you need to teach, you need to introduce sexual education to school, but there should be the consent received from parents if it's not in the school. But as the NGO sector, we at least can talk about that with the country. It's important. And we can say that sexual education is not just about sexual orientation and gender identity. It's about examining your own body, and that it's not, you shouldn't be ashamed to talk about that. If someone has violent behavior towards you, you should talk about that. But most want to learn it, especially when it comes to practice, and we teach how to put on condoms. It's very difficult. I've seen how people were afraid to mention even some certain parts of the body. But this will not happen tomorrow. If we do not talk about it tomorrow and we will delay it for the future, it would be bad. We should better talk about that now. You work in the NGO sector, you have more opportunities than the system of public health, because medical system is so inert that it's practically not realistic to change it. But look for the doctors and you will find support. We have some activists who are now at this conference and who can help us, right? Sorry. The topic is so interesting. You mentioned that NGO sector has more opportunities. Yes, yes. Can you tell us more? What you as an expert and the doctor expect from the NGO sector, so that it's easier for you and your colleagues to provide protection, to prevent. especially when it comes to the population which is vulnerable to violence, to infection.
Дивіться, медична сфера працює
The medical sphere
за наказами.
works according to orders. The order says clearly what I should do. The person comes to me, I have to inform the head of the institution, and the head of the institution should inform the National Police Service. If the person says that doesn't want the passport data to be disseminated, then they will tell just that such a thing happened. I cannot do anything which is not according to the order. We need to amend the law. The law should have something which will allow me as a doctor to do what I believe. Who could do that? The doctor will not do it. The doctors will just wait for that. How NFP works. We have an international initiative, international law, international recommendations. When we amend the protocols, we believe that we introduce the best global practices. We took the UNDP document, Ukraine translated it and did something, and they said, here's the instructions for the doctors, you have to do it this way. In order to introduce amendment to the document, they are to be upgraded every 5 years, but we have orders which are 20 years old. For that, we need initiatives. Who comes with initiatives? These are international organizations. And the groups, international groups, they go and they talk to Ministry of Public Health. They go to ministry for the first time, second, 21st time, and if such organizations go there, the regular doctor will not go there. If he goes, he will not get into the office. I know Marina. We have one person who we know, Tatiana, and she has worked in MOZ for 3-6 months, and then she left, and then she was trying to reach them via general prosecutor. The doctor or director of the clinic will not be able to resolve any situation. And the NGOs they are more media open. We had a question, can the medical institution promote their doctor? For example, can they write that we have a great doctor, come to us? And they cannot do that. Because I say the hands of the public sector are not strictly tied up. I would like to defend the Ministry of Public Health. I'm not criticizing, I'm just saying I want to defend the Ministry of Public Health because now amendments to Order 278 are being introduced. We developed the form. Tatiana did a lot to develop the form, and she continues to work in this direction. I know that. And we also introduce some other amendments, and NGOs get involved. And what are these changes, these amendments? I understand that you all are tired, but what is the idea of changes, what we would like to do? We want to do it so that in this order, taking into account the provisions of Istanbul Convention, we want the doctor not to be obliged to inform about the victim if it's not criminal case, if it's not about a child, and if it's not, so that the doctor doesn't have to inform the national police bodies about that. We want to give the right to the person to select whether the person wants to that it is informed to the national police bodies. What did we do? I hope that we will be able to come to agreement with the Ministry of the Interior. What we did, we developed the template. We took some textbook, and it's on registering the cases of violence. We took recommendations of World Health Organization, and then also we have another form, 511, and it's about, it doesn't suit when it comes to registering the cases of domestic violence or gender-based violence. And now we are talking about sexual violence connected to war conflict, to armed conflict. The victims come who do not have any wounds, but or any bodily damage, but this template is for registering not just bodily damages, but psychological traumas, and it's for registration of more information about the case. Very often, the doctor asks or interviews the victim, and that is something that traumatizes the person. When you are interviewed many times, the investigators, I know how one person informed that he has a client, and the investigator requested her to demonstrate how she was raped, or to tell how many times it was, what were the poses, and how many there were persons, how many persons raped her. So it's difficult to communicate that. And that is why now they introduce amendments. There are many organizations. We have planned the meetings with organizations of victims of domestic violence, and there are also victims of sexually based violence related to armed conflict. We cannot say that nothing is done now, because the organizations are listening, and civil society organizations give some comments, and these comments were heard, and the amendments were introduced based on these comments. And the Ministry of Public Health really hears your comments. Well, I tell you that they hear the organization, not a separate doctor. Citizens can go individually, but it's worth going as an organization, because it's more powerful than if you go yourself. Thank you all for this discussion. Today we've heard many important things. Maybe you learned something new for yourselves, and it's worth talking about that. It's worth discussing it. It was mentioned, we talked about the teenagers. We need to work with the Ministry of Science. We need to disseminate this information. I thank you all for this discussion. I thank our speakers who have really deeply discussed this topic. And I would like to address the audience. I'd like to ask you not to be afraid to ask questions, not to be afraid to talk.
боятися говорити
about
про
yourselves, about cases
випадки неправомірного ставлення до вас,
of some bad
тільки таким
attitude
чином
to
ми
you,
можемо,
because only this way
ми можемо запобігати
we'll be able to avoid
неправомірним діям щодо нас,
illegal actions against us, because if we keep silence,
ще більшої
that
ескалації
leads to
всього, що
escalation
відбувається,
of what's
може
happening.
відбуватися. Тому я вам дуже дякую.
So
Можливо,
thank you
у
all.
вас є ще питання до
Maybe you have some
до
additional
спікерів,
questions
до
to
мене,
speakers, to
або
myself,
або ви хочете просто поговорити.
or you just want to talk.